Today I want to cover Retiree Medical and Cobra, the different enrollment periods for Medicare, the USA medical system, original Medicare, private plans and your Medicare options, important dates, and of course we'll go into Q&A after the video is done. So, why do I have to enroll in Medicare when I already have group coverage? Well, Medicare's guidelines is quite interesting what they consider active employment and just having retiree group coverage. So, let's go. Retirees must enroll in Parts A and B, or their retirement medical may not pay for services. So what this basically means is if you're not an active employee or a spouse of an active employee who has an active group plan, that group plan can not pay or deny claims if you don't have both Medicare Parts A and B when they look for a payer for that service. Basically, it's pretty much to ease the burden off the employers because it can be expensive to carry medical, and because Medicare is an entitlement that everyone who's over the age of 65 can get. Medicare says that if you're a retiree, you can get Medicare, and Medicare will give you better access to discounted medical services so that we can get some of that burden off of the employers when you're eligible. Next, Cobra does not count as credible coverage for Medicare. Also, Cobra benefits only last up to 18 months. Now, in special circumstances, Cobra can last up to 36 months, but those are more for periods where, let's say that I am turning 65, but my wife, who's a year younger than me, was on my plan. So it gives her an extra 18 months after I get onto Medicare so that she can have a plan for her while not being eligible for Medicare yet. So in most folks' circumstances here anyway, it won't get extended. And also if it did get extended, you'd be looking at even more penalty for your Part B. And in this video, I'm not going to go over too much of the numbers of what the penalty is and all that stuff, just know that you have a penalty if you do not sign up when you're supposed to. Next, retiree coverage does not entitle you to a special enrollment period onto Medicare Part B if and when coverage ends. So basically what this means is if you did not get onto the Medicare program when you were supposed to, i.e. when the active employment of your plan ends, which is going to end in September of 2021 for you folks listening for the Hawaiian Airlines, basically you will be unable to enroll in Medicare Part B because these retiree plans or Cobra is not considered credible coverage that allows you a special enrollment onto the Medicare program. Next. So when can I enroll in Part B? Matt, you told me when I cannot and why I cannot. So when can you? Well, you can enroll anytime in which you're actively employed. So according to the documentation we have from Hawaiian, everyone here is actively employed until September 2021. After that point, you have up to 8 months to enroll in Medicare. So what that means is you have 8 months from September, or basically from October, to enroll into the Medicare program without incurring any kind of a penalty. Unfortunately though, remember how I said back in the previous slide, if you have retiree medical, the medical may not pay for your services. So if, let's say, October rolls around and you don't sign up for Part B, practically in full scope of legality, the medical plan that you folks have could deny claims because they say, hey, you're over 65, you're eligible for Medicare, you're entitled to Medicare, and you're not signed up, and you're on a retiree program, not actively employed, we're not going to pay for the claim. So please be sure to sign up for at least Part B when you are stopped being actively employed. So basically sign up by October 1st for Medicare Part B. Well, there's also the parts of Medicare, right? There's C or D. If you want to do a Medicare C plan, that's Advantage plan, or Part D as in drug, you have up to 2 full months after your current employment ends. So you have up to December 1st to enroll in either a Medicare Advantage plan or a Part D drug plan. For those of you folks who are looking for a Medicare Supplement or Medigap policy, you have up to 6 months after your Part B effective date to enroll in that plan. Anytime you do after that, you'll have to qualify via health underwriting. So it's much easier to get these Medicare Supplement plans early on, because from the day your Part B starts up to 6 months thereafter, Medicare or the Medicare Supplement company cannot ask you any medically qualifying or disqualifying questions. All right, so let's get to our first knowledge check. I can keep my retiree coverage from Hawaiian Air. True or false? And you can pause it here to give you more time, but I'm just going to go ahead and give you folks the answer. It is true. You can keep your Hawaiian Air retiree coverage from Hawaiian Air, and it will not affect your Medicare coverage. Conversely, though, or reversely, if you don't have Medicare coverage, that can affect your Hawaiian Air Retiree Medical. Next question. I can delay my Part B enrollment until my 12 months of sick bank and then enroll in Medicare. You can pause it here if you need more time. I'm going to go ahead and give you the answer. It is false. So if you try to enroll in Medicare Part B anytime after the 8 months from your last date of employment, you actually have to wait until what's called the general enrollment period. And that period starts from January 1st to March 31st. When you apply during that time frame, your coverage actually doesn't start until July 1st of that year. So for those of you folks who would run out of medical in October, that would mean you'd have about 9 months with no outpatient or drug coverage. Don't let that happen. Our last knowledge check for this section. I don't need to enroll in Medicare Part A and B to get full benefits from my Hawaiian Air Retiree Medical. Is that true or false? False. According to Medicare, those eligible for Medicare under any type of retiree plan must apply for Medicare Parts A and B. This is because Medicare becomes the primary payer of your medical services. If you have any questions about what we went over, you can either rewind the video or you can go ahead and write down those questions and email me. Next. Another question I get quite often is Medicare any good? And this is quite funny because I think Medicare is probably the best insurance you can actually get in America for a variety of different reasons, but here's some of the questions that I get asked. Can I keep my same doctors? Usually, yes. If your doctor accepts original Medicare and you are a current patient, they will usually continue to be your doctor. Most doctors actually, in Hawaii anyway, they don't get paid any more on the HMSA plans. Medicare, the reason why Medicare gets such a bad rap is because Medicare is like discount reimbursement for the doctors. So let's say instead of seeing someone who is on a group plan, they see someone who's on Medicare. They might get paid substantially less for the person on Medicare. But in Hawaii, specifically on Oahu, the payment difference between someone who's on an HMSA group plan and original Medicare is somewhere in the range of 5%. So they are more than happy to remain your physician as long as you're a good patient. And the main reason why some people have kind of said no to patients who are transitioning onto the Medicare program are those who are retiring really soon, and they just use that as kind of an excuse for getting you out of the door and trying to get you to establish care with a new doctor ASAP. Next question I get. Can I go to the hospital? Yes, most hospitals accept Medicare, even the Mayo Clinic. So Mayo Clinic, the Cleveland Heart Center, MD Anderson Cancer Center in Texas, all of these places accept original Medicare. Most of them will require you to have a Medicare Supplement plan as well, because the Medicare Supplement plan pretty much ensures that they will get your portion of the payment. But yes, Mayo Clinic accepts Medicare, and all hospitals will accept Medicare for emergency care. And most of the hospitals across the U.S. will accept Medicare Part A as full and pretty much the desired payment. Last one, I heard Medicare doesn't cover a lot. Well, Medicare covers anything that's medically necessary aside from dental, vision, and hearing. Now, that's with an asterisk, and I didn't put an asterisk on here. Pretty much for dental, vision, and hearing, Medicare doesn't really like to restore things. So if you have you need fillings, or if you need a root canal or an implant, Medicare doesn't cover that at all. Medicare has about 6 different items that they cover for dental, and all of those are in the hospital where you may require some kind of a jaw surgery due to cancer or some kind of dental assessment due to mouth cancer. So it's very, very limited for the dental coverages. For vision, don't worry. They cover you if you have eye infections. They cover you if you have a loose retina. They cover you for cataract surgery. What they don't pay for, though, is corrective lenses or corrective contacts. They also don't pay for any kind of hearing aids or any kind of hearing assessments. Now, they do cover certain hearing tests to determine if you have certain autoimmune diseases, and they will, of course, help you if you have an ear infection. Now, if you have any kind of these concurrent illnesses where you do go to the doctor to get service with your ears, your eyes, or your mouth, teeth, please check to see if that particular service is covered by Medicare. And you can do that by going to Medicare and typing in what does Medicare cover. And Medicare has a simple application where you can go and type in the service and it'll let you know if Medicare covers it or not. I'd also ask the physician who's delivering you that care because they typically will know. Next, how does medical insurance work? If you guys ever wanted to know how medical insurance worked, now you're going to get to. So, this little infographic I made was made by our national brand Plan Advisors. And what it's supposed to show us is that this is how the medical system works. There's you, the patient, our client, there's your doctor, and then there's your insurance. And what we try to do is we try to bridge the gaps between your insurance and your doctor. And of course, you as the patient. So how does it even work? Well, first it gets started with your doctor who needs to put in the type of service to be covered. It might be a diagnostic, it might be a treatment, it might be a service. And then the insurance company looks at the available services for the diagnosis or the treatment and makes a decision based on their kind of internal guidelines. From there, depending on whether or not you like their decision, it's either approved or denied. Lastly, you can either pay the copay, provided that the service is approved, or the entire amount if you must, or you can appeal the insurance company's decision. And that's where it can get kind of icky, as Medicare has 4 levels of appeals, and it can get really hairy if you don't do things by the book, so to speak. So, how often do denials happen? Well, there's not that much data, as they only started tracking denials in the past maybe 4 to 5 years. And the data set is pretty much biased because we only get the ones that actually are reporting. So it could be people or companies who are proud that they're not denying that many services. But here, let's go take a look. So, according to a study conducted by the Kaiser Family Foundation, which is completely separate from Kaiser Permanente, different entity entirely, about 17% of claims were denied by healthcare.gov health insurance plans. And the reason why I put this is because this is what group plans are based off of. They're based off of the Affordable Care Act, Obamacare. All health plans that are administered and given by employers have to be ACA compliant. So 17% of claims were denied on that type. Medicare Advantage, though, only denied 8%. So we're doing pretty good. Let's dig a little bit deeper. Alarmingly, about 75% of the Medicare Advantage denials, when they were contested, were reversed in favor of getting care coverage. So what this means is, in a quick overview kind of a way is that if you have care denied, fight for your right to care. Because 75% chance, that's 3 out of 4 of all the claims that were contested were overturned in favor of the client, the patient, the member, and the doctor to get the care. Now, lesson 2 is find a way to not to use insurance that has so many restrictions. What do I mean by that? Well, that's pretty much what Medicare is, the original Medicare program. And let's see what that's all about. So what is Medicare? Well, Medicare is the U.S. government's largest health insurance program. By the time of this recording, there's probably over 60 million beneficiaries on the Medicare program. And it's directed by CMS, the Center for Medicare and Medicaid Services. There's different parts for Medicare. Parts A and B are original Medicare. Part C is Medicare Advantage. It's known by many names: Medicare Advantage, Medicare Alternative, Medicare Private Plan. And there's Part D, which is prescription drug coverage. We call these PDP for prescription drug plan, or Medicare Part D, or just simply drug plans. And Part C and Part D are both managed and only managed pretty much by private insurance companies. So, what does Part A do? Part A helps cover hospital stays, skilled nursing facility stays, hospice care, and home health care. And then we go over to Part B, and Part B covers doctor visits, outpatient care, preventative services, occupational and physical therapy. Pretty much just say Part A Part A covers you for everything that you need inside some sort of medical facility where you are admitted. They give you that little bracelet and you go in and you're there overnight. Part B covers everything else. So doctor visits, physical therapy, outpatient surgery. A lot of the knee surgeries and cataract surgeries now can be done without a hospital stay. That's considered Part B. And all of your annual wellnesses and preventative shots and vaccines done inside the physician office are considered Part B. Again, this is all original Medicare. It's offered by the federal government. It covers much but not all of your care, and they mean that both in the financial sense and in the coverage type, meaning that, like I said, dental, vision, hearing, not included. Original Medicare Parts A and B don't include pharmacy medications, and of course you have deductibles and co-insurance. Let's try for another knowledge check. Medicare doesn't cover dental implants. True or false? If you need some more time, pause the video. Here's the answer. True. Medicare doesn't consider dental, vision, or hearing part of original Medicare's covered services. Consider saving additional money on the side or purchase additional insurance to pay for these services. I suggest to get some money on the side to pay for these services unless you have very niche dental, vision, or hearing needs. Then you can look into getting different plans that might help your particular circumstance. Let's say you need a lot of fillings or you lose a lot of fillings. You got a lot of work coming up in the next few years, or you have medical dental needs like you have diabetes or pre-diabetes, so you need extra cleanings every year. Then consider dental insurance. But if not, many times if you just do a couple cleanings a year, it's cheaper just to save the money on the side and pay your dentist by using cash or credit card without processing any insurance. Next, Medicare Part B covers inpatient hospital stays. If you need more time, pause the video. If not, here we go. Yep, this one's false. Part B covers outpatient services like doctor visits and lab tests. Medicare Part A covers the inpatient hospital, skilled nursing care, and hospice. Our last knowledge check for this section. There are no prior authorizations on original Medicare. This one is kind of a throw in because we didn't really talk about prior authorization. We did talk about denials though. Remember the denials. All right, so there are no prior authorizations on original Medicare. If you need more time, pause the video. If not, let's get the answer. This is false. Under original Medicare, prior authorizations are very rare, but they do happen. For certain spinal neurological implants and durable medical equipment like powered wheelchairs, medical will require a prior authorization. But other than that, the prior authorization list is quite small, and you'll have a very smooth usage or smooth experience with the original Medicare program. All right, we are mostly halfway done. I know this video is kind of long. We're already in 20-minute mark. You're doing great. Well, let's see. We have private plans and how they work together or in place of original Medicare. Now in this section, if you want to take a break first, you can pause the video. If not, let's go right into it, where we go over the private area of Medicare, the private sector of Medicare more precisely. So, what are your Medicare options? Well, many people use Medicare coverage in one of three different ways. Now, there's more ways to kind of combine this, but these are the basic three ways that most folks in Hawaii use their Medicare, receive their Medicare. The first option is you just get original Medicare, you get Parts A and Parts B, and you get a drug plan, because original Medicare doesn't cover drugs. Now, the problem with option one is that original Medicare has no maximum out-of-pocket. So if you have a lot of services that are done in the outpatient section, you could be potentially looking at an uncapped bill of 20%. I've had a physician tell me that he had knee surgery on both of his knees in the hospital, and because they were in and out surgery, his bill, had it not been for Medicare and TRICARE, he would actually have to have paid about $15,000. So it can be quite expensive if you do not have some kind of a stop loss or Medicare Supplement or Medicare Advantage plan to help you avoid catastrophic costs. Option two is the option that I mostly recommend, and that's going to be a Medicare Supplement or Medigap policy. And this is where you'd pay an additional monthly premium for the Medicare Supplement. And what Medicare Supplements do is they pay all or part of the original Medicare deductibles and coinsurance. And also with this option, you do have to purchase a standalone drug plan to get Part D drug coverage. And I do suggest always having a drug plan as well, because it will, number one, avoid the penalty that you have to pay if you do intend to enroll in the plan at any time, and also give you a stop loss if you ever need really expensive medications. The third option is Medicare Advantage. And unfortunately, a lot of folks do go to the Medicare Advantage route simply because it's easy. You pay a monthly premium sometimes. It usually includes extra benefits, and everything is managed by one company. So the drugs come for free or included. Sometimes it has dental, vision, gym memberships. But like I said earlier in this video about if you can avoid having insurance companies, that typically can lead to a little bit less friction when you're receiving care. So it's something to consider. All right, so let's go check out what the private companies or private parts of Medicare cover. So Part C, that's the Medicare Advantage. They're supposed to cover everything under original Medicare, and they can include additional services. And most of them include a Part D drug plan. Now Part D just covers drug, and sometimes they're included in the Medicare Advantage plan. Part D, very simple. They're basically the way you get medications. They are only offered through private companies. Part C is also known as Medicare Advantage, and Part D is also known as prescription drug coverage or prescription drug plans. Next, Medicare Part D. So these are only offered by Medicare companies, Medicare insurance companies. The federal government does not have their own Part D plan. They're all contracted with the federal government. They must offer at minimum the basic coverage required by Medicare. So basically what the basic coverage is, in an overview nutshell, is Medicare says that you need to have at least 2 different medications for each class of treatment. So they may not cover the drug that you are taking, but they are most likely going to cover something similar to what you are taking that treats the same illness or is in the same treatment regime. And this is why it's very important to shop your drug plan every year, because these drug plans can change. They can even change interim. They can change during the year. And then you have to contest and try and get your medication back if you lost the one that you had. Also, all Medicare Part D plans have a formulary. So every year you have a chance to change your drug plan. And I highly suggest plugging in your drugs or giving them, let me know what you take, and then we can go and make a better decision for you going forward, or at least the best decision going forward at the time. Because like I said, the drug plans, their formulary can change, unfortunately, every month if they wanted it to. There's two ways to get this kind of drug coverage. You can either get a Part D standalone drug plan, or you can get it through a Medicare Advantage plan. And that's what we acronym as MAPD, Medicare Advantage, with prescription drugs. All right, so the fun part. Now, Medicare Part D works kind of like car insurance. And I only say that because car insurance is really the only way that we can kind of visualize having a deductible. So Medicare has, first step of Medicare is an annual deductible. In 2021, the most the annual deductible can be is $445. Sometimes these deductibles are only applicable on brand name and above, whereas generic medications, there are no deductibles. Once you have paid through the deductible, you'll get what's called the initial coverage, where you have a copay or coinsurance. And typically it's going to be anywhere between $45 to $47 for brand name. And if it's a coinsurance, it's typically going to be anywhere between 30 to 40% of the drug cost. Step 3 is the dreaded coverage gap. And this is what other people consider or say is the donut hole. This is where you're going to be paying 25% of the drug cost. And only about 12% of all Medicare beneficiaries on Part D reach this stage. So about 1 in 8 will be unfortunate to get through to the coverage gap. And you reach the coverage gap when your insurance company and yourself have paid $4,130 based on the retail cost for the medications. And the only way to get out of the coverage gap is to spend more than $6,550. And this is in a calendar year, yeah. So you have to spend quite a bit of money in order to get through the coverage gap and into what's called the catastrophic coverage stage. And the catastrophic coverage stage, only about 4% of Medicare beneficiaries reach this stage. But if you do reach this stage, then the medications become quite cheaper. It's either going to be 5% or $9.20 for brand names or $3.70 for generics. And it's the greater of, yeah. So if you have a medication that costs, I don't know, let's say $10,000, you will have to pay 5% of that, not $9.20. So they take the higher of the two. And if you think that's not possible, wait till the next slide. Cancer medication is so expensive that even with proper Medicare Part D plans, your out-of-pocket cost for a single medication could be over $11,000 in a year. So I'm not talking 5% of $11,000. I'm saying that your out-of-pocket could be over $11,000. And here's a slide that I found. It's a little old, 2016, but as you can see, toward the bottom of the screen, there's a cancer column, and it's called Revlimid. Now, Revlimid for an annual, or how much you'd end up paying for this annually, is $11,538. And as you can see, 76% of that amount is during the catastrophic phase. So when you're paying just 5% of the drug cost, it is equivalent of 76% of $11,000. So the drug by itself is anywhere in the realm of $20,000 to $40,000. Like can't do the math right now, but it's really expensive for this medication. And even if you're just paying 5% of it, it can really rack up the prices. So I do suggest to all of my clients who kind of want to get something, I suggest getting a cancer plan to help in case you do experience some of these costs. Cancer plans typically have a payout of anywhere between $10,000 to $15,000 depending on how much you want, and that'll cover the Part D kind of coverage gap that you go through, even though you went through catastrophic. Medicare Supplement plans, that is the second route that you can go through for Medicare, the private plans anyway. Medicare Supplement, Medicare Medigap, Plan G, Plan F, Plan N. These are all Medicare Supplement acronyms or different names, also known as. They work with original Medicare. What that means is you have a primary insurance, similar to the very beginning when I talked about you got primary insurance, Medicare, they have to pay first, and then your group coverage, for those of you with the extended sick leave, the group coverage pays second. So basically what happens is your original Medicare pays, and then the Medigap policy comes and pays your portion, the co-payments, co-insurances, and sometimes the deductibles. And it's designed to give you a more stable out-of-pocket estimation for how much you're going to be paying per year on medical services. Each Medicare supplement has a unique blend of benefits. Medicare beneficiaries may want this type because it can make the costs more predictable. And of course, we don't have all those limitations that the private insurance company has. Medicare supplement plans, even though they are private insurance plans, they work off of the original Medicare guidelines. So as long as original Medicare covers it, your Medicare supplement plan cannot say, hey, no, we don't approve that. As long as Medicare approves it, they are bound to approve it as well. And of course, all the plans are federally standardized. So any plan G, for example, you get in Hawaii would be the same plan G someone would get in, let's say, Florida. So I've made a simple algorithm to figure out which Medicare plan letter you should get. Don't worry about all the different ones. There's about 8, maybe even 12 by now. But there's really only 3 that people should really pay attention to. The first one is F. So, Plan F is the most expensive plan. It covers everything at 100%. Now, the best way to figure out if Plan F is better for you than Plan G, think about this. Is Plan F's annual premium, you add up 12 months of premium, and you then add up 12 months of Plan G premium, and if the difference is more than $203, then you go with the Plan G. Okay, if not, you have found where you need to go, and you go with the Plan F. Next, Plan G versus Plan N. If you go to the doctor's offices more than 2 times per month, and or any of your physicians you see do not accept Medicare assignment, if you answer yes to one or both of those, then you choose a Plan G and not Plan N. You stop here and you purchase Plan G. Now, everyone else who made it this far, you can choose a Plan N. Unless, of course, you want what's considered the best Medicare supplement plan, then go back up a level and choose the Plan G. Now, the major difference between Plan N and Plan G is after the $203 annual deductible for Part B, on Plan N, you have a $20 copay for the doctor's office and a $50 copay at the ER. And Medicare Plan N does not pay for excess charges, which is if the doctor that you see does not accept Medicare assignment. So very rare for doctors, especially in Hawaii and most of the U.S. In fact, in a lot of states, not accepting Medicare as payment in full is illegal for the physician. So it's not something that many people have to worry about. But if you do want that Plan G, I mean, it's up to you, right? All right, so let's go into another knowledge check. I can get a Medicare Part C plan and my drugs through a separate Medicare Part D plan. You can pause the video if you need more time, but here's the answer. No, the answer is false. Medicare does not allow you to enroll in both a Medicare Part C and a Medicare Part D plan. Over at the Medicare offices, if you did enroll in a Part C plan and then sign up for a Part D plan, you'd be disenrolled from Part C and then enrolled in Part D if you did that during what's called the annual election period. You can also flip that switch and say if you enrolled in a Part D plan and then after that enrolled in the Part C plan, you'd be kicked out of the Part D plan and then enrolled in the Part C plan. So make sure you know what you're doing, especially when it comes down to timeline and how you are getting these things done. Because during annual election period, you can actually sign up for as many plans as you can find. And the last one that Medicare registers is the one that they are going to put there. And they can only put one. Next. I need to get a referral to see a specialist if I'm on original Medicare and have a Medicare Supplement plan. Many of you should get this, but if you need some more time, pause. All right, here's the answer. False. Because you'll be using the original Medicare rules and network, you aren't required to get any referrals to see a doctor in the United States who accepts Medicare. And this is very, very important for those of you who want to see doctors, but perhaps don't want to let your primary care doctor know, or your primary care doctor is a little bit too busy and can't fit you into the schedule just for a referral. You can go ahead and make a call to the doctor, and as long as he or she has space on their schedule, they can see you. Next question. I can enroll in a Medicare Supplement plan at any time. This one's a little tricky. I'll give you a little bit more time. If you need more time, pause. The answer is true. Like I said, this one is a little bit tricky, but you're actually able to enroll in a Medicare Supplement plan at any time if you can qualify via underwriting. Now remember, during that 6-month period after your Medicare Part B starts, there's no questions asked, so you can get any Medicare Supplement plan from any Medicare Supplement plan company you want to. But once that 6-month period has elapsed, you will have to do medical underwriting and then qualify for the Medicare Supplement plan via that route. So make sure you sign up before it's too late. And our last one for this segment, if I join a Medicare Advantage plan, I still must pay my Part B premium. True or false? And this answer is true. Even though your Medicare benefits are now under the control of a private insurance company, you still need to continue to pay for your Medicare Part B premium. Pretty much what Medicare does is they take all the money that they've collected from you for your Part A and your Medicare Part B premiums, and they provide it to the Medicare Advantage company, and that Medicare Part B premium is factored in to how much you will get. So if you join a Medicare Advantage company and stop paying for Part B, you actually will be disenrolled from the Medicare Advantage company because you need to have both Parts A and Part B active in order to be enrolled in a Medicare Advantage plan. Important dates. So the annual election period, that happens between October 15th through December 7th. And what you can do is you can enroll in a Medicare Advantage plan or enroll in a standalone Part D plan. And when you enroll during this period, the effective date of these plans are the following January 1st of the next year. So this is the time when all of my clients will reassess their Part D drug plan. And for those clients of mine that have a Medicare Advantage plan, we would reassess with the new plans that are available for this coming year. Next is the special enrollment period. And special enrollment period, now this is going to be different for each person because you can get one for moving. You can get one for ending employer coverage, is what you folks are doing. And also there's a variety of other enrollment periods that are available depending on certain circumstances. Medicare has an entire list of things that you can do to qualify for a special enrollment period, but a lot of them are very, very unique. So if you get institutionalized, you are put into a nursing home, you have an enrollment period. So that doesn't happen very often. If you move to a new location that has completely different plan options, that's one. So like I said, very, very unique circumstances for individuals, but necessary. So when making a Medicare choice, what should you consider? Cost. Medicare Supplement plans do have an additional premium per month that you have to pay. And like all health insurance premiums, they go up every year. Also, if you are on any kind of Medicare Advantage plan, make sure you know what the deductibles, coinsurances, and copays are for the services, because Medicare Advantage plans, while they don't make you pay much more per month, they will make you pay when you receive services, or make you pay by making you wait for services, or simply not approving services. Benefits. Do you need more benefits than original Medicare offers you? Do you need to buy an additional health or an additional hearing, vision, or dental plan? Do you need Part D drugs? And I would say for the last one, yes, you do need a drug plan. Convenience. So if you join an HMO plan or a PPO plan, are the doctors in the network located conveniently to you? Is the nearest hospital 30 miles away? Is the nearest in-network cardiologist 30 miles away? Those are questions you're going to need to get answered before you join any of those plans. And of course, providers. Are all your doctors and preferred healthcare facilities, are they in the plan? And are they in network? And are they willing to accept you if you are on that new plan? Again, for original Medicare, it's not very difficult. As long as they accept original Medicare, they probably should continue seeing you. So, now we went over everything that you need to consider. Now think about yourself. Do you have a chronic condition? Do you feel your healthcare needs will grow in the near future? What kind of drugs are you taking? Do you think that the increase, or that your drug spending or your drug cocktail will increase in the next couple months? Do you need more coverage than just Medicare Parts A and B? And I, like I said, would consider everyone who's listening in on this call, consider Medicare Supplement plan to help cover any kind of catastrophic problems, and also to make sure that you guys have access to the original Medicare network without huge copays when something happens. Medicare Advantage plans may help cover unexpected healthcare costs as well, but you run the risk of having or of not getting coverage when you need it the most. And I've had many clients of mine who are on the Medicare Advantage route that have had issues with their coverage. All right, that's it for me. If you have any questions or wish to contact me directly, please email me there. For those of you who have already started the Part B application process and wish for me to give you a Medicare analysis, please email me that you need help now, and I'll put together a plan for you folks depending on the questionnaire that you folks answer from me, and I'll send that over to you as soon as you need it. And again, these are just a recommendation. You're not by no means obligated to enroll or obligated to buy anything from me. This is just to help you out, to give you a good idea of what things are going to cost you. And you can ask anybody else who's talked to me for the past couple years, trying to figure this out. It's the long game, and we're trying our best to get you guys the best coverage and put you folks in the best position, medical wise, for your future. And I look forward to answering your questions soon.